My guest today is Dr. Theresa Regan. Dr. Regan is the founder and director of the OSF Healthcare Adult Diagnostic Autism Clinic for ages 14 and over. She has experience with autism assessments, reaching nearly 1,000 adolescent and adult evaluations, working as a neuropsychologist, specializing in brain-behavior relationships. It is no secret, Dr. Regan is a specialist for adults with autism. Dr. Regan is an author of a book series called Understanding Autism and host of a successful podcast, Autism in the Adult, where she covers vast amounts of useful everyday benefits of adults with autism, whereby she reaches audiences to better understand adults with autism. Her podcast features various series for a variety of topics and is, in my opinion, provides such valuable insights on how adults with autism can learn necessary skills and understanding to better navigate life. In addition, Dr. Regan has experience being a mother of an autistic young adult. These topics of adults with autism are extremely important to me in my personal life, and I'm very thankful for her consideration and knowledge. And now, my conversation with Dr. Theresa Regan. Dr. Regan, tell me about your journey into psychology and into autism, and then specifically adults and adolescents with autism.
Well, I had a kind of a backdoor journey, which I think has actually been a real blessing for me. So in high school, I thought I wanted to do something with my life that involved the brain and understanding the brain as far as thinking and how we become who we are. And so I ended up studying in graduate school clinical psychology, which means I work with clients and their families. And then I specialized in the brain part of that, which is neuropsychology. And in neuropsychology, you get to pick, would you like to focus on adults or would you like to focus on children? And so I ended up on the adult track, which usually includes like adolescents, adults, and then geriatric adults. After that, I had trained in many hospital settings, and I ended up getting a professional job in central Illinois, Peoria, Illinois. And I worked in the hospital setting and continue to. I'm at 25 years here now at OSF Healthcare in Peoria. And boy, I've had the opportunity to see lots of different things and learn lots of different things. And mostly I focus on, in adults, how changes in the brain wiring and structure can impact thinking skills and also emotional expression, personality, and behaviors. So that was my base. So I might, for example, do a checkup with someone to see if there looks to be a dementia process going on, or I might work with someone who has a traumatic brain injury or an infectious brain injury. So I got to do that for a long time throughout my training and then also in the hospital setting. And again, that was just such a great global, broad experience. And then I became a mother. And in our journey with our son, it was confusing and just, it was hard because he seemed in so much distress and I didn't know how to help him or what was, you get lots of advice as a parent, but you can still feel very isolated and alone and trying to figure out how to help your kids. And so he had interventions from an early age. And then at about 4, I requested the autism assessment, and that was done through Easter Seal. So he was diagnosed just after he turned 5. And I remember thinking, I am not prepared for this. I do I do not know what I'm doing. And then I stopped and I thought, my whole life has really prepared me for this in some ways. Like, I at least have a framework for understanding that brain wiring impacts how a person experiences the world, how they express themselves. I at least have that lens, that framework. And so I'm a very kind of activated person. So when I'm stressed, I kind of jump in and I try to learn and I try to experiment with what might be helpful and what's not helpful. So over that journey, then I'm also, of course, working at the hospital, and I'd see patients in the hospital setting and the staff would be confused, like, I just don't understand what we're missing with this individual. How could we help them? How could we understand? And I'd think, I know what this is. It's undiagnosed autism. And it may be in an 82-year-old, or it may be in, a 54-year-old. And not only do pediatric specialists not know how to recognize it in adults, but adult specialists don't know because they don't focus on developmental issues, and they don't realize that developmental issues impact the presentation and the needs of that individual throughout their whole lifespan. So I just had experience after experience where it was such a blessing to be able to add that component of understanding to the staff, to the client, to the family members. And then I thought, I just really want to dive into that more. Mm-hmm. And at some point, I realized I'm just really providing this service. We should just make it official and say, we do this type of service for adults. And so the administration gave me permission to form and name and put into practice the Adult Diagnostic Autism Clinic. And I've done over 1,000 assessments now. And I think, I start at 14 as the age range that I see. And then I think the oldest diagnostic assessment, the person was in their 80s, like maybe 82. And I realized too how important it is to distinguish autistic characteristics from what might look like a dementia to someone who doesn't know how to recognize the developmental features. So I came in through the back door, but that gave me another viewpoint, a different perspective that I've been really blessed by.
Wow. So I got a couple of different things from that introduction. It's like, in my experience, it seems like the most educated people with autism are those that live it or around it within the household.
Yeah.
And it's superior over any research.
Yeah. I think there's part of the living day to day that you just can't get from a book. I mean, in graduate school, I certainly learned about autism. And of course, we know much more about it now. Mm-hmm. And I had gone to conferences about it before, and I didn't even realize what I was seeing until, he was about 4. So even as a neuropsychologist, it's really hard to translate what you're seeing into this vocabulary of neurology, especially for young parents too. I think parents are encouraged to be to require the same behavior from all of their kids and to have very close, clear consequences. And what I've really been blessed by is the ability just to be a detective with people and be like, wow, they're really overwhelmed. What has led to this, and how can we help them regulate better? How can we help them feel better? And what a breakthrough that is for for people to be able to look at it in that different way.
Yeah. Um, I'm delighted whenever you said that you just typically jump into things. I think action, jumping into things, and stress are anti-correlated. So if you just get into it, your stress will calm. I wish more people would understand that. Um, as a psychologist, did you feel extra pressure because of you were navigating this, and you should be well informed, or maybe even like an expert?
Um, I I think that also was a blessing to me to realize that all the book knowledge in the
Hmm.
world, because my graduate program was like 9 years after my bachelor's degree. So it's an intense brain program. And all this knowledge, you know, there's always something we don't know. And that piece of humbling experience. And I remember thinking back to things I have thought in my mind that with life experience I would never say again. Like, I remember walking into Walmart before I had a child, and I saw a child, maybe 3 or 4, in the cart, and they were they had a pacifier in their mouth. And I, in my infinite wisdom, not being a parent, thought to myself, that would never happen in my house.
Hmm.
And, then as a parent, my child had this fixation with turning and holding 3 pacifiers in each hand and 2 in his mouth. And that was how he regulated, and he'd turn them, and I had to go into Walmart really quickly. I never took him into any, but I had to grab a photo. So I said to him, and he probably was around 4. So I said, we're just going to run in really quickly, and you can only take one. And I said, it's going to be really quick.
Hmm.
And sure enough, someone in the line started to tell me about how to stop that. And they're like, here, you can just take it out of his mouth. And they were taking it out of his mouth. And I had to remember that humbling contrast. And like, that was me. Without life experience, that was me. And so it
Yeah.
also has given me some grace to
Yeah.
let people be in a different place than I am,
Hmm.
because they haven't had that experience. And so I just was able to say, you know what, we're not going to do that today, but I appreciate your input. Um, so it's a humbling experience to live it and realize that you didn't have the whole picture. And it also, I think, if handled well, allows you to extend grace to people who don't understand or are in a different place. And that's okay.
Yeah, it would have been a typical or an easy reaction to kind of get onto that other person uh, for not knowing anything about what's going on.
Yeah, and I could have felt very criticized, and as a parent, and parents get weary of criticism, but again, because I had had that experience in Walmart, and I had processed that since then, and I thought, what a contrast. And I
Yeah.
was able to choose then in the moment, instead of being really emotional or shaming to them. I was able to stop. And so I think that's been my experience, that here I am with all this book knowledge, and experience is the way that you really grow. And can I grow while extending grace? So I think, that's been one of the biggest takeaways as far as my professional intersection with my personal life.
Yeah, that's wonderful, and it's I'm reminded of your brain behavior relationship as a neuropsychologist, and just having an extreme interest with neuroplasticity and how
Mm-hmm.
we change and develop all the time.
Yeah.
Well, that's pretty cool to me. Um, so, what are some common themes adults with autism come to you with, and what that looks like for them and their life,
Yeah.
and for them around others?
So one thing to keep in mind, and a lot of times when I share stories, I'm sharing experiences that are based in a time of struggle. So as a clinician, people come to me in a season of struggle. That
Yeah, that's a
doesn't
real
mean
quote.
that, yeah,
Yeah,
that doesn't mean that everything about autism is struggle.
yeah, yeah,
But when people intersect in my clinic, they're coming for assistance, and that they've been in a season of struggle. So, a lot of times, the themes are that they've hit a roadblock in their ability to understand themselves and to shift their behaviors to meet the expectations of others.
yeah,
And people around them are confused and they're confused. And there can be this kind of shaming situation. And it kind of goes back again to some of the parenting things too. Like, as a parent, you get a lot of this input, like, that wouldn't happen in my house. And
yeah.
again, I've said that.
Mhm.
And, or things like, if your child is struggling, it's because you aren't doing something correctly. And then as they get older into adulthood, they get the message that if they're struggling, it's because they're not doing something well. And we have this kind of American, and I'm sure part of it is just a human outlook, but in the United States, we have this value for independence and determination and willpower. And there are posters around that say the only thing holding you back is you. And so, but what that can lead to, if you don't understand neurology, is this feeling like if you are not meeting the expectation of the classroom, if you are not meeting the expectation of the Christmas party or whatever, it's because you don't have the will or determination to regulate yourself in a complex situation. And so, one of the themes that has been, and again, I think this is one of the biggest reasons to get a clarifying diagnosis, is that if something is a stumbling block for someone's wellness and it's related to a traumatic experience or, poor life choices or whatever, our psychology approach can be very helpful if the difficulty regulating or meeting their goals is related to a nervous system that needs something different. We need to know that. And not only can it break that cycle of shame and stuckness, like I'm stuck because none of the traditional things are really helping me to overcome this. But it gives new approaches that you wouldn't otherwise have. So you have a better understanding, you have new approaches, and the theme of why are we stuck? Is it because of you or me? That can be broken, and we can focus on being detectives and figuring things out together and partnering together. So regulation, the ability to stay calm and psychologically present in various situations, can be one thing that people present with as far as struggle. Communication and relationships could be a point of struggle. And sometimes it's that adulting piece, like
Mhm.
just getting through the day. And why am I brilliant in physics, but I struggle to pay my bills on time or whatever? So those would be some common things, but the overall shift could be about this greater understanding, breaking those assumptions that just keep us trapped,
Yeah,
and then
yeah,
focusing on solutions for those stumbling blocks.
yeah, yeah. I think an easy way to describe autism is lacking adaptive responses, especially from the some of the neurobiology of autism, um, and how we have to integrate into society and social norms, and that's very much in contrast of the autistic phenotype. And without knowing that you have the autistic phenotype, like officially, that can be very challenging.
Yeah. Yeah, I think, and a lot of the challenge is just that people don't know. I mean, they don't, there's just a lack of knowledge, and that's something we can help with, so autism has become a household word in many respects, but at the same time, not many people know what it looks like.
Yeah,
Uh,
they know. Yeah, yeah, yeah.
so translating, like, this is neurology in this person, um, can be really important. But yeah, the brain's um, neurologic architecture that we're born with, the more knowledge we have about each individual, the more enlightened we can be about, because we'll always say, what does this behavior mean? Because
Hmm.
behavior is communication.
Hmm.
So if somebody who doesn't know autism interacts with someone, they're still going to be saying, like, what does it mean that they looked at me that way? What does it mean that they didn't say this or they did say this? And we're supposed to get meaning out of behavior. But if they don't know that neurology presents that way, then there's these wrong assumptions. Well, they just don't care enough, or they don't care about me, or they're focused on this interest and they think it's more important than me. So if we can introduce this knowledge that this is what neurology looks like in this person, and their behavior doesn't mean that you've been rejected or you've been slighted. It means that this is what intrigues their wiring. This is what their wiring loves. And how do we translate that so that both people's needs can be met and that you can understand each other? So it's not me against them or them against me, but it's, oh, we have nervous systems and this is what yours looks like.
Yeah, okay. Yeah, so I had a follow up question, and I was wondering some helpful tools or protocols that you might have in your experience, especially with the amount of autistics that you've worked with. So they might be kind of general things that's helped, but I was just curious if there's some common protocols or tools that you guys work with or work with.
Um, so I think one intervention tool is essentially explanation, like translating. So, um, even when people come, often they come with family, or
Hmm.
they, even when they suspect this might be what it is, they often don't see all the pieces that hang together in the brain and why. So part of the big intervention is pointing that out, like, your brain really loves this,
Yeah.
and this works for you in this way, but look at how it could work against you in this way. So really giving them that more true narrative is one of the interventions, I think. And then um, one of the things I think is so important that um, no counselor or teacher or physician really is going to bring up is the use of physical inputs for regulation. And I think the autistic really needs that. And what I mean is that looking at that proprioceptive and vestibular input to just calm and regulate the nervous system. So what we tend to do if someone's dysregulated, if they're upset, or if they can't get activated, we tend to talk to them about it. So let me tell you why you should be in a different place emotionally. Let me tell you why you should behave differently. And this talking while someone's dysregulated is not really helpful to the autistic because talking is draining. So the autistic is like, I'm already drained. You're talking to me about being drained. Let's send you to counseling so that you can talk more about how you're drained. And I have nothing against counseling. I do it. I think it's very effective, but there's something else the autistic needs, which is how do I just get my nervous system to feel calmer and to feel better in my own skin before we start talking about regulation. And so what I love to think about is, if we have an infant that is screaming and crying and they just get very dysregulated, and talking isn't going to help them, and explaining why they don't need to cry isn't going to help them, and punishing them or whatever. But what does help them is holding them, which gives them pressure input, proprioceptive input, or swaddling them, and rocking them. That's vestibular input. So we have this very innate nervous system pattern built into us. Everybody who has a nervous system has this. And a lot of us use strategies to calm and center the nervous system based on this principle without even thinking about it. Like one person might say, oh, riding my bike outside is the best. I just feel really calm and rejuvenated, but I can't ride on a stationary bike. That's not going to do it. Well, what they might be saying is, I really need that movement input because vestibular input needs you to move through space, like rocking, right? And then what I love about this is everybody can use these tools. It's an inherent nervous system thing. So everyone can relate to it. And it really lends itself to this detective mindset of, oh, your nervous system really likes this. And so if somebody, is pacing or they're overactive, they're not sitting down, we could say as a detective, oh, wow, your body really wants some movement now. How else could you get that? Let's see if a swing helps you feel better regulated. And you get this partnership, you get this detective kind of thing. And then people learn how to take care of their nervous system. Otherwise, what happens is we get into this kind of pattern where we try to make sure everything in our external environment and life is just so that our nervous system feels okay. And we spend a lot of time trying to make sure unexpected things don't happen and loud things don't happen. And that's fine, but it is impossible to totally do that. And it's exhausting. So adding this element of how are we going to take care of your nervous system today? How can you get pressure input? Pressure input gives the brain proprioceptive signals, and that calms the nervous system. How can we get you vestibular input where the fluid in your ear is moving? Do you need a rocking chair? Do you need to ride your bike? Do you need a hammock? And that gives the brain centering input. And how does that fit with you? And so that's part of the really activating thing too. Let's be a detective. Let's partner together. And then let's figure out how to get your nervous system what it needs. And to use those physical inputs is so important, I think, because talking through other strategies this reliance on talking first, I think, can be too overwhelming. Let's help your nervous system feel better first, and then we can talk through some things.
Yeah, that's incredible insight, and I think unfortunately it's not considered as often as it should be. I was thinking about Temple Grandin designing the squeeze
Yes,
machine.
exactly. Yeah.
Yeah, and it's just so helpful. Everything you described. I like squeezing paper towels in my hand.
Yes. And that, you sharing that gives people ideas, right? It's kind of
Yeah,
a creativity based on a revelation. So we have this revelation that squeezing something feels good. And then we have this innovation or creative mindset of how else could your system get that? What kind of effective way? What kind of, how can we really get the most out of that for you?
yeah. Also, as you were describing that, I was thinking that you're giving people an ability to kind of zoom out of the situation and have more perspective on what is happening and what are some other options that I can do.
Yes. Yeah, you need someone, and it's, we're stuck a little bit because we don't have enough experts who can help someone step back and see the big picture.
Yeah.
And so they're stuck in their own skin and in their own head, and they're like, okay, what could I do? But they can't move beyond that. And the expert is supposed to say, what I see is this pattern. Have you noticed this pattern? And then they'll say, oh, so that links with this. Okay. You need someone outside and who's knowledgeable enough about the brain and neurology to start to show you pattern, how the pattern works for you and against you, and to have this creative partnership. So people who are trying to do that on their own, I applaud them,
Mhm.
for that that journey to figure out yourself. It ideally, it would be nice to have an expert to come alongside and to say, I'm wondering if you've considered this,
Yeah,
because this is how neurology works and I'm noticing this.
yeah. That's I hope people can catch on to that. That's valuable information.
Yeah.
So I know in your podcast you talk a lot about different aspects of life. So I have a couple that I really want to ask you about, and the first one is, how about adults and relationships?
Yeah. And and what I love about the diagnostic piece again is this um, ability to break some of the misunderstanding about relationships.
Hmm.
So I gave some parenting examples because that's where I learned, in parenting my son, but these examples across the lifespan. So, how does this pattern and way of interacting impact friendship or dating or retirement or marriage or kids? And that's another benefit of having someone outside of yourself to say, okay, you're in a new season. So our bodies change over time, our brains change over time, our chemistry changes, and our life circumstances change. So um, those all kind of coincide. And someone could say to you, hey, I think the things that you used to regulate yourself before this relationship, um, are less available to you now because you have this schedule, or you're
Mm.
with this person. They don't like, interacting with that activity, or they want more one-on-one time. So someone to help partner with you to say, how were you regulating before? And are you getting enough regulation now? And how could we shift that? And then things like communication. So I'm just a firm believer that any characteristic that we have as humans, our strengths need to be identified. And then we need to understand that our strengths work against us in certain situations. It's not that this characteristic that I have is all good or all bad. It's that it really works for me here, but boy, I can get stuck in this area, with this. And so, social relationships and communication can have some of that too. So the individual who has that self-knowledge may be able to see in their new relationship how that impacts them. For example, they may be great and love having conversations about very interesting topics or let's work on this project together, but if they're with a partner who wants to have heart-to-heart conversations and gaze into each other's eyes, that may be fine, but the self-knowledge part can say, my nervous system leans toward task or topic-oriented activities. I see that your nervous system really likes to connect with relational discussions, and I want to be there for that. But this is how my nervous system leans. So all of us will make sacrifices in a relationship with a partner. And for example, if you're making that sacrifice and you're like, I really want you to get what you need, let's have that relational conversation. Then I'm going to need some alone time or a bike ride or whatever to regroup after that. So this is me showing up for you, and I want to do that. I also want to reset my nervous system after we do that. So the ability to know that about themselves and then to have words to wrap around that, to communicate that to somebody else.
Mm-hmm.
And it goes back to that thing that we're always, whether we realize it or not, we're trying to figure out what that behavior means. What does it mean that he doesn't want to talk to me? Mm-hmm. Well, it may not mean a whole lot. It may mean that this is how he expresses love in the relationship in this other way. But to be able to start with that knowledge and for the autistic to be able to recognize that in themselves and communicate it, that can be huge, because it can break up that tendency to get stuck and to just have kind of a shame or a relationship where the biggest communication is you're not living up to my expectations. That can be very wearying and a big misunderstanding, really.
Yeah, there's a lot of almost barriers to being compatible with other people.
Yeah, and if you know what you enjoy the most in relationship, you can consider that when you're joining with a partner. I think what doesn't work is thinking that all relationships should look the same and then trying to become that person, because our relationship should look like these people who have a relationship. And I think if you start with your own nervous system and the nervous system of your partner, what makes me tick? What makes them tick? What do they need out of a relationship that I don't need? And vice versa. And then are we compatible? Because compatibility may be there with someone else who also loves to talk and do rather than gaze into someone's eyes and, process emotions, neither of those approaches are all good or all bad.
Yeah.
But you can't consistently give someone all they need emotionally all the time if your nervous system works in a different way. So starting with the self-knowledge.
Yeah. Yeah. There's a lot of autistic phenotypes have competing goals. Everybody has competing goals.
Mm-hmm.
The more we do one thing, it's going to subtract from us being able to do the other things. But with autism, like with the restricted fixated interest and the scheduling and the difficulties with social communication, yeah, this the whole relationship part of it's something that I personally struggle with quite a bit. I know it's maybe too personal, but autism came on the radar for me from um, romantic relationship and coworkers. So various forms of relationships, and it was just like, okay, wow. I mean,
Yeah. And I think um, with romantic partnerships, if you have that self-knowledge, sometimes you can make choices that are a little outside the box. Like I have couples that do really well, but
hmm,
um, they each keep their own living space. And maybe they've been together 9 years, but
mhm,
why do they do well? They have their own space. They realize how they work best as a couple, and they're not trying to make their relationship look like someone else's relationship. I think another thing that happens with relationships can be that over time there's increasing complexity in adult romantic relationships, a lot of times because the longer you're with someone, you know, then you're expected to go to weddings with them or meet their family or go to their holiday family vacations. And maybe you have children together. And this multitasking
mhm.
starts to come into play where it's not just a one on one relationship.
Yeah,
You have this exponential demand start coming. And that means you are extending yourself in these multiple areas and probably don't have as much access to what regulates you. Um, and it can feel like life just kind of goes on without asking our permission, right? To expand and change. And so attention to what, the social media relationship or family looks like versus what actually fits me. Uh,
there's a lot of pressures.
a
Uh,
lot.
yeah, social comparison and fitting in. I
Yeah.
think a lot of conversation was just fitting in, and a lot of early on, a lot of just like modeling people
Right.
because that's what we're supposed to do, and how much conflict that it actually ends up being.
Right. It's kind of funny because parents talk about their teens and peer pressure, but we all feel peer pressure, don't we, at any age? So and so is retiring to the to the Florida Keys,
Mm.
and I don't have that. And so we're always comparing, and it doesn't do us much good.
Yeah, as you was describing some of that, it's like, yeah, it makes sense as you're explaining it. We work inward and then work out from ourselves. Because if this isn't broke or this
Right.
isn't fixed or functioning, then all the entangled social dynamics of life will be off. That's very powerful. What is your experience with adults and employment?
Yeah, that's a difficult thing, isn't it?
Yeah.
Um, sorry.
Yeah, yeah, you're fine.
I think there's a whole range of how that looks, and how people experience that. And I think we don't have the big picture yet because we don't have everyone diagnosed correctly yet.
Mm-hmm.
The people that we have diagnosed may be people who've hit a real difficult season and gone in for more assessment, or maybe who have relatives who've been diagnosed, or so it's difficult for us to make conclusions about the big picture of employment and autism. I certainly know that there are autistics, in all levels of employment. But having said that, the challenge, I think, can be resiliency.
Yeah.
Going in every day, every
Yeah.
week, every month. And sometimes, so I think, you've heard of that term, autistic exhaustion. I think
Mm-hmm.
resiliency can be a core challenge. And resiliency can impact relationships, and it can impact your job and, the ability to keep doing all these activities. And so that's what I do hear a lot, that it's difficult to stay in the same job, for a decade or whatever, and make a living and pay your bills over the long term.
Yeah. Yeah. It's a lot of challenges there.
Yeah.
Just with the scheduling, that like B2, the scheduling and sameness, and then adding in more social webs entangled with that.
Yeah, there's definitely a big social component.
Yeah.
I think that's why helping the autistic understand their nervous system and communicate it to other people,
Mm-hmm.
that can be helpful in the work setting as well. Trying to figure out what fits your nervous system the best as far as work, and also sometimes making decisions about, not taking the most intense, prestigious job. Even if you're brilliant at something, that it may not fit your system to work 60 hours a week. It may not fit your system to do presentations in other nations, or, there's a point at which caring for your whole system means I'm not going to take that promotion, even though I'm tempted to, because it's going to look good. People are going to acknowledge my talent and my skills, and I'm going to get more money, but the intensity is going to go up. And that really does hurt me in a lot of ways. And I'm not willing to pay that price and service to a promotion. But that's, again, kind of against our American kind of culture of how are you getting better? How are you,
Mm-hmm.
so to shoot for balance and how something fits you, um, is not always applauded in the same way. But I think, it, it really pays off. And for people in a different setting, let's say it's not occupation, let's say it's school, I see this as well. Like, well, they should be in all honors classes because they're brilliant, Well, yes, they can do the work, but you have to take into account their whole life picture. How much demand is on this person? How much drain to their nervous system? What are we doing to support and fill their nervous system? And is there anything left over?
Yeah. Yeah. Yeah.
And if we're saying this person, their personhood is important, not just their physics knowledge, can we support them in self-care? Can we support them with having extra and not being drained to exhaustion before we feel like, boy, they're really doing a good job.
Yeah, there's education, employment, relationships. Those three things that we talked about today are very challenging.
Yeah.
And the insights you gave us is just things that are kind of outside the box that hopefully people can consider and find some benefits to.
Yeah, I think it does in a lot of ways introduce a different worldview. Where to start when we're making life choices, and are we prioritizing something that we feel is the greatest good, and are we making choices that help us along the marathon, or we're just going to sprint
Mm.
for a while and collapse? But again, that can be very against the social media picture. It can be very against the American way of, if you want it enough, you go get it. If you don't have it, it's because you don't want it enough. So it does challenge us. And when we feel ourselves like cringing at the thought of taking regular classes instead of honors, or turning down a promotion, or whatever, that's a good cue that maybe we should think through what we value the most. If I'm going to cringe about that, why is that? Let's do some exploring of our own beliefs, and why we hold those, and whether they give us the greatest good.
Yeah, well said. Um, Two things before we wrap up. Um, Tell us how we can follow you and um, get introduced to your work, both as in the clinic and share something that you're most excited about recently.
So I would direct people to my website, really, to look at maybe my projects and my work. So that's adult and geriatric autism.com. The website just got revamped, so I'm excited about that. It's simpler. I think it's easier to navigate. There's a link for the podcast. There's links for video courses. There's links for the blog. So hopefully it's kind of organized in a way that's user friendly. You can also contact me through the contact page. My work in the hospital for diagnosis, one tricky thing about that, and it is aligned with what we've been talking about, is that I have a 4-year wait list. So that's professionally, it's really stressful for me as well. Like, I want to help people. And so my website is really my answer to that. Like, I can't see everyone in the office, but I can extend some knowledge and thought-provoking ideas through the website. And I think the nicest innovation I have now on the website is the opportunity for video visits in some geographic
Mhm.
areas. So the one thing COVID did that was very nice for us is allowing video visits across state lines with certain license restrictions. So I do have a video visits tab on there. I've met some great people already through that. And so that's a really nice option. And I think there's a nice combination of, lots of free resources and some paid resources, and the books and things like that on the website.
Okay. The I just imagine that the video chats, the video therapy, based off of everything we discussed here, is very valuable and is a very efficacy.
I think so, because again, you've got, how nice is it to have someone from the outside that can say, you know what, I would really consider this, or I see this pattern,
Mhm.
because you may not have that expert in your neighborhood. We've had people from 11 other states travel to our clinic because it's not available locally. So I want to make that accessible. And again, some changes in the law and what we're able to do from COVID have allowed me to put that on there. So it's only been on there for like a month or two, but video visits are available and the information's on the website.
Wow, wonderful. Wow. Well, Dr. Regan, thank you so much and good luck with everything, and I'll be following along for sure.
Thanks, Ryan. I appreciate the talk and the opportunity to come on.
Yeah, thank you. If you're listening to the podcast or listening to the episode, please feel free to leave a review or ratings. In podcasting, review and ratings are crucial, and I very much appreciate your feedback. You can contact me on X at RPS47586 or click on the hop link so you can have links to all the show platforms and contact information. You can email me info.fromthespectrum@gmail.com. And thank you for listening to From the Spectrum podcast.